Okay, I did my presentation on migraines versus headaches and the treatments for both. So, yeah. Just ask the question, what is a migraine, what is a headache, and how are they treated? Okay, so migraines are described as a complex condition of the nervous system. A migraine is usually described as a very intense and pulsing pain that occurs on only one side of the head. And scientists, we don't have we're not for sure on why they're caused, but scientists speculate that this is because of disturbances in nerve pathways and brain chemicals, which affect blood vessels close to the brain surface. The blood vessels swell and it sends pain to your brainstem, which is where your brain processes pain. The most simple and general treatments are stuff like staying hydrated, good sleep habits, exercise, eating healthy. That can prevent a lot of migraines. Other treatments include acute treatment and preventative treatment. Acute treatment involves over-the-counter pain relievers, such as, how do you say that? Aspirin and ibuprofen. If these drugs do not work, your doctor may prescribe drugs that combat the cause of migraines more specifically. These drugs can include triptans like sumatriptan. The ergot type drugs may be used as well, such as dihydroergotamine nasal spray. If you start to have chronic migraines, we use preventative drugs that are similar to drugs prescribed for epilepsy, depression, or high blood pressure. We have no real cure for migraines, just stuff that can help them. So yeah. For migraine treatment, the most simple and general treatments for reducing the chance of migraine. Oh wait. Oh, it didn't save, I guess. I changed all this. You can just go to the next slide. Headaches are usually characterized into two separate categories, sinus and tension headaches. There's also cluster headaches, but I didn't do too much research on those. Tension headaches are the most common type of headaches. The pain for tension headaches is usually in the head, jaw, or neck. The pain is dull, constant, and usually on both sides of the head. Stress is the most common trigger for tension headaches. Sinus headaches are caused by an infection in the mucous membranes. This infection is caused by inflammation in sinus membranes. This is a result of a cold or flu virus, and is usually accompanied with a fever. A lot of times people will think they have sinus headaches, but they're actually migraines, which is surprising. So yeah. Treatment options for a tension headache include a hot or cold compress, relaxation techniques, therapeutic massages, and over-the-counter medications. Treatment options for sinus headaches include adopting a healthy lifestyle mainly. This can be used for pretty much any of them, and using medication for cold and flu symptoms to prevent the infection from occurring. And I just have a video kind of going over migraines.
If you've never had a migraine, you might think it's just a really bad headache. But if you have ever had one, or you know someone who gets them, you know that they are much worse than that and much more complicated. A true migraine is a multi-symptom disorder of the central nervous system that affects the brain. But yes, really bad headaches are a major component of it, probably the single most significant and identifiable component. But usually they last longer than a normal headache, anywhere from 4 hours to several days. And it brings along with it a whole array of other symptoms. Most migraine sufferers experience extreme sensitivity to light and sound, and sometimes even smells. They also commonly experience nausea, vomiting, even fainting. What little relief they can find is generally only achieved by being in a still, dark, silent room until the symptoms pass. And believe it or not, it gets worse. Migraines also cause problems both before and after the headache. It's different for everyone, but the ordeal can start with symptoms as seemingly minor as constipation, weird food cravings, neck stiffness, or excessive yawning. As the symptoms worsen, people generally enter a phase called aura, in which they may experience things like visual disturbances, like seeing shapes or lights, blurred or double vision, or even loss of vision. Pins and needles sensations in the extremities infirmities, weakness, and sometimes even slurred speech. Now, you may notice that these sound a lot like the symptoms of a stroke. And in fact, migraines have so many things in common with strokes that doctors sometimes have to do tests to determine which disorder they're dealing with. After the headache is passed, most migraine sufferers experience a period of weakness and fatigue that can last from a few hours to a few days. Obviously, this isn't the sort of thing that anybody wants to experience, so what causes it? Can it be controlled or at least treated? Doctors think that migraines probably are caused by a sharp drop in your brain's level of serotonin, a neurotransmitter that plays a key role in regulating things like sleep and mood. And once that imbalance strikes, it causes a whole cascade of effects. But what actually triggers this imbalance is complicated and uncertain. We do know that one of the most important factors is genetics. If one or both of your parents have experienced migraine, odds are that you will as well. For reasons that we do not understand, women are far more likely to have migraines than men. And they're even more likely to experience one during times of hormonal changes. For example, puberty, menstruation, ovulation, pregnancy, when using hormonal contraceptives or hormone replacements, and during menopause. Beyond that, everyone's triggers are different. For many people, it may depend on their stress, their activity level, or sleep schedule, all things in which serotonin plays a role. And still others may be triggered by things as seemingly random as bright lights, loud sounds, unusually strong smells, or even weather changes. The treatment of migraines is further evidence that it's not just a headache. It's true that the headache itself can sometimes be treated with pain relievers, although they're often less effective. So in addition to pain relief, migraine sufferers may take medications that try to treat the source of the attacks, like by controlling the constriction of blood vessels in the brain, blood pressure, serotonin levels, and inflammation. So clearly, a migraine is more than just a bad headache. Remember that when you hang out with people who get them. If they're in a bad way, the biggest favor you can give them is just let them be by themselves in a dark room. You can keep watching the sideshow, but do it very quiet. And thank you for watching this sideshow dose, especially to our subbable subscribers who...
Okay, and we'll do just
Did I skip a slide?
no, that's all.
keep these episodes